and for today's demonstration, I will be performing assessment of thorax and lungs. First thing we're going to do is assemble all the equipment and supplies. For this procedure, we will only be using this stethoscope. After that, provide for client's privacy. In women, rip the anterior thorax when it's not being examined. And lastly, determine client's family history of illness, including cancer, allergies, tuberculosis, lifestyle habits such as smoking and occupational hazards medication being taken, and current problems. For the implementation, inspect the shape and symmetry of the thorax from posterior and lateral views. Compare the anteroposterior diameter to the transverse diameter. Inspect the final alignment for deformities. Palpate the posterior thorax for respiratory execution. Place the palm of your both hands over the lower thorax with your thumbs adjacent to the spine and your fingers stretched laterally. Ask the client to take a deep breath while you observe the movement of your hands in any leg movement. Sir, can you please take a deep breath? Palpate the thorax for vocal pruritus. And the perceptible vibration felt through the chest wall when the client speaks. Ask the client to repeat such words as Blue Moon or 1, 2, 3. Sir, can you say 1, 2, 3 repeatedly?
1, 2, 3. 1, 2, 3. 1, 2, 3.
Ask the client to bend the head and fold the arms forward across the chest. Sir, can you please bend your head and cross your arms across your chest? Forecast the intercostal spaces at about 5 cm intervals in a systematic sequence. Compare one side of the lung with the other side. Forecast the lateral thorax every few inches, starting at the axilla, working down to the 8th rib. Next is aspirate the thorax using the plastics diaphragm of the stethoscope. This is the systematic zigzag procedure used in percussion. Ask the client to take slow deep breaths through the mouth. Can you take a normal breath? Listen at each point to the breath sounds during a complete inspiration and expiration. Compare findings at each point with the corresponding point on the opposite side of the thorax. And lastly, document findings in the client record using forms or checklists, supplemented by narrative notes when appropriate. Report deviations from expected or normal findings to the primary care provider.